biologist, has shown that 85% of the population, or at least 50% if you want to take other references, are living with H. pylori.
I think that data is hard to interpret because a lot of it is based on serology. Serology, once you're infected, you'll always be positive. And so a true test of active infection really depends on some of those other studies, breath testing or stool antigen. And a lot of that prevalence data doesn't use that. So you have to interpret those data with a grain of salt.
And your grain of salt would tell us what percentage of Americans today in Europe
Infecting humans for generations, for over 60,000 years. So to think that we need to just eliminate it completely, I think, is a risky thing to do, but I'm not sure. I'd love to hear what some of the ID docs
just before we
think.
go back to questions, how do you say that it's been present for 60,000 years? How can you make such a statement?
So I'm not an expert in sort of the testing that they've done to look at those genotyping of old cells and whatever, but I did try to read that article, didn't really understand the testing on how they did that.
I have a few comments and some questions. One, it was shown some time ago that patients with renal
Medication.
second comment and question is that we've used urease containing bacteria as probiotics, and my concern would be that if I'm giving more product, could I be increasing H. pylori? And
Yeah, the guidelines have looked at probiotics in treating patients who, or as part of treatment. Theoretically, it makes sense to give a patient probiotics if you're giving them antibiotics, especially 2 or 3 different antibiotics, but there's no strong evidence to promote that practice.
I just have one question. I'm really interested in the use of antibiotics and the effect it has on the microbiome in the human. And it seems that the bacteria that we've had for hundreds of thousands of years, that we're using a lot of antibiotics in the past couple decades, which may be screwing up something that's been protecting us for hundreds of thousands of years. Do you have any evidence to suggest that antibiotics that we're using nowadays is affecting H. pylori in terms of like increasing the incidence? And if so, any specific antibiotics that we use commonly as house staff?
So we know that the resistance patterns, given the most commonly used antibiotics against it, have generated specifically clarithromycin and levofloxacin resistance. And so the incidence doesn't seem to be increasing, but the resistance is increasing. Now, how that will play out, I think I'm not sure how.
Dr. Rougeau, finally, the 2 take-home points that you think are most important that you have presented to us for medical students and house staff. What are they, 1 and 2?
So I would say that H. pylori is common. Don't forget about it when you're encountering patients with some of these typical things we encounter, like dyspepsia. Test for it, treat it, and then sort of think about that quadruple therapy as maybe your first line agent in some of these patients, and really ask them about their antibiotic exposure.
And the second point?
That was 2. So the one other thing I'll add is those penicillin allergy patients, really try to pin down whether it's a true penicillin allergy. And sometimes, even if you've avoided penicillin in the past, and this patient who you think has a penicillin allergy, consider sending them to an allergist to test them for it, because amoxicillin resistance is actually pretty low. And so that's an option in some of these patients if they don't really have a penicillin allergy.
Thank you for a clearly unique